Today, after almost a century of trying, health insurance reform becomes law in the United States of America.
The promise of affordable health insurance for millions of Americans. The most significant investments in primary and preventive care that we have ever seen. Major expansion of community health centers. Incentives for delivering quality primary care and keeping patients healthy. Scholarships and loan forgiveness to build a new generation of primary care providers. And most importantly, transforming the system to put the patient at the center of care.
People should be in control of their own care. They should make decisions about what affects them. We say, nothing about me without me. It's putting the patient in the center of the care system and giving them power and control over their own lives and their own care.
With staggering rates of unemployment, a rising tide of chronic illness, and crushing healthcare costs, primary care is critical to keeping families and communities healthy and reducing the burden of healthcare costs on families, businesses, and government.
There is no way that I can see that we will ever get our hands around rising healthcare costs, except that we build that very strong front end on the system that's capable of both prevention and primary care management.
Since 1993, the Primary Care Development Corporation has been strengthening and expanding primary care to communities in need.
Our mission is to get good, effective primary care into low-income communities. We found successful strategies for dealing with some of the most important issues in primary care to address both increased capacity and a very much more effective model of care to make communities sound and whole and strong.
Providing the capital to build new facilities, expand practices, and upgrade outmoded equipment, leading to better services for more patients.
There are people that not only loan you money, but they help you to understand better how to even spend it. So then we can do what we know best, which is to really provide primary care in these kind of communities.
All of the communities that we work in are communities that have suffered from disinvestment over the years. What we're looking to do is to reverse that trend.
Helping providers redesign their practices, use technology effectively, prepare for emergencies, and deliver high-performing, patient-centered care.
PCDC really has been our partner in most of the initiatives that we've undertaken, and they're helping us on our medical home project. We put a group together with PCDC to figure out how to organize the primary care of the patients, and the staff started to understand what it meant to be patient-centered because they really had the feeling that whatever patients needed, we were going to try to get.
Working with policymakers to make primary care a priority and secure needed funding and reforms.
We really used PCDC to understand how we could get a high-performing health system by moving more resources into primary care. We also had confidence that PCDC has been developing the infrastructure so we could say there are community health centers ready to take on this load.
But we have a long way to go. Too many patients still lack access to quality primary care. Too many get care in emergency rooms or go without. And with millions of new patients expecting quality care, investing in primary care is more crucial than ever.
We are done.
Healthcare reform is something that we have dreamed of and worked for since the beginning of PCDC, and now we have it. But it's going to pose the challenge of reforming the healthcare delivery system so that everyone can have access to primary care.
Healthcare reform challenges us to transform our healthcare system, and PCDC is ready to meet these challenges. Ready to invest in health centers that reduce costs and deliver quality care to families. Ready to create more good healthcare jobs in our communities and help healthcare workers transition to patient-centered care. Ready to help more providers become medical homes. Ready to seize this once-in-a-lifetime opportunity to transform our healthcare system and meet the challenge of providing quality, affordable healthcare to every family and community. We now have healthcare reform. We're entering an era of new challenges and possibilities. Primary care will be crucial to our success. And PCDC is ready.